Thank you very much for this opportunity, Dr. Doggett, board. My name is Dr. Cathy Riekeman. I have been in continuous practice in Albuquerque, New Mexico for 37, going on 38 years, license number 486. My dad was a chiropractor here in the state, practiced for 38 years before he retired, and I have an older brother, as many of you know, that is also a chiropractor who's president of Life Chiropractic College in Marietta, Georgia, Life University now. I've heard an awful lot of eloquent presentations from both sides of the issue. I'm not near as eloquent, and I have a tendency to go for the elephant in the room. So this won't be a dry legal discussion. First of all, I want to say right up front that I don't believe that anybody, from my point of view, believes, and I think they've been misinterpreted. I don't think any of us believe that our colleagues that are on the other side of this issue are ignorant, uneducated, and some of the other representations that Dr. Jones referred to. We all have been well educated. We have extensive education in basic sciences. Our basic science education rivals that of the medical profession. What we're saying is that we do not believe at this time that the chiropractic colleges provide an equal education in medicine. And that's where we have a lot of our problem. I'm not going to bore you with a lot of statistics, but I do want to hit the safety issue. In surgical neurology, April 2006, they reported that the annual cost to treat complications from side effects of medications exceeds $1.5 billion. In the Journal of the American Medical Association, 1998, they made the statement, the correct drug for the correct diagnosis and the correct dosage will kill 106,000 Americans per year, making it the fourth most common cause of death in the U.S. That's with the highest trained people, the highest trained individuals, the highest trained physicians. Side effects of the non-steroidal anti-inflammatory drugs: heart attack, stroke, high blood pressure, heart failure, kidney problems, bleeding and ulcers in the intestines, liver problems, asthma attacks, constipation, diarrhea, gas, heartburn, nausea, vomiting, dizziness. I'm not telling you anything that pretty much everybody in this room doesn't know, okay? I understand, you know, what you're saying when you say, hey, we've got some things here that we can bring forward that can help our patients, and you know, we're coming from a point of compassion. My side says we're coming from the point of compassion in that we don't want to expose our patients to this type of situation. You know, in Spine 2003, it showed that chiropractic adjustments, they used the term CMT, was shown to be better than 5 times more effective than the NSAIDs Celebrex and Vioxx. The Journal of Occupational Environmental Medicine, April 2001, concludes that chiropractic care is more effective for common work-related low back pain when compared to treatment by PTs or physicians. Surgical Neurology, April 2006, reported a study in which 59% of patients who were taking NSAIDs for chronic spinal pain were able to discontinue the use of those NSAIDs after 75 days of omega-3 fish oil supplementation. My question is, or my comment is, when we can see that chiropractic has so much to offer without the introduction of these dangerous drugs, why would we even want to go there? You know, I don't understand it. I just think it's unsafe. Now, I don't have a problem with the AP as it was originally presented, which was, hey, there's this thing out there called Codex. They could take away our ability to prescribe or to sell or give our patients vitamins, minerals, herbals. And quite frankly, some of the AP docs took the training for that reason. They wanted to be sure that Codex would not take away their ability to do that, okay? I don't have a problem with that. It's when we start pushing past that point that I have a problem. My other problem, and we're in the safety issue, and it's been brought up repeatedly, is the amount of education that's being proposed. My question is, if after December 2012, the education that's going to be required for AP docs is going to have to be at a master's level, why isn't that level presently what should be acceptable? Okay? And as many others have pointed out, there already are avenues for chiropractors who want to prescribe drugs to go get an NP license, go through other established lines to do this. I don't have a problem with somebody hanging up a shingle that says chiropractor and nurse practitioner, chiropractor and PA. I just have a problem with, from what I can see, reading in our journals, reading on the NMCA listserv, that many of the doctors have a larger agenda. And that's what I mean by the elephant in the room. We've already heard an awful lot about the legal issues. It seems that there are some real gray areas, and I have a real problem with the board moving forward on these things when there's that many gray areas. I feel, and I believe if I understood Dr. Jones correctly, I have the same feeling. This is too muddy, this is too gray an area. It needs to be cleaned up legislatively. And then we have a public forum where we all can present what we feel is appropriate. I have a real problem with our scope of practice being shoved forward and pushing the envelope by rule of board. And I know that's becoming more of a popular thing, but, and Dr. Doggett, correct me if I'm wrong, but you did write an editorial in the Dynamic Chiropractic where you pretty much stated that you felt like that scope of practice for our profession should be determined solely by the examining boards. That makes me uncomfortable because so many of the boards in so many of the states are not elected by the chiropractors that you're regulating. You're appointed by a chiropractor. I mean, excuse me, you're appointed by a governor, okay? And like it or not, there are instances where one particular, I hate to use the term faction, group in our profession may have more political connections than another group in the profession. And so we end up with a board that may not be that fair and balanced. In New Mexico, right now, this may have changed a little bit, but there are about 490 chiropractors in New Mexico. My understanding from Dr. Pearlstein recently stated on the NMCA listserv that there are about 100 AP chiropractors in the state. That figures out to about 20% of the chiropractors in New Mexico. Of those AP doctors, my sense is, from what I'm hearing and reading, that there are those that just want the right to be able to handle vitamins, minerals, and herbals. There are those who want to be able to move into the area of injectables, but natural injectables. And then there's the group that wants to push into becoming chiropractic medicine. They talk about that podiatry, osteopathy, optometry would be good models for our profession to follow to get where they want to go. Well, if you go look, podiatry, osteopathy, optometry, those are not postgraduate trainings that they receive. That's within their basic 4-year education. So that would lead me to believe that there are those AP doctors that want to change our profession to be called chiropractic medicine, and that it would be taught in the schools. I have consistently heard that those of us who are questioning this are not justified in questioning it because we don't have to do it. And that's true. Those of us that are right here in this state right now who have a license, we don't have to do it. But it's like the example that I heard in the Consumer House Committee. One of the lawyers there said, well, I don't understand why you guys have a problem with this. You don't have to do it. I'm a lawyer. I don't like divorce cases, so I just don't take divorce cases. Problem with that example is he had to take that coursework in law school. He had to prove that he had knowledge of that coursework to graduate from that law school, and then he had to prove he had knowledge of that coursework to get his license. I think that it's not either naive, people don't understand the history of these things, or they're just being disingenuous to pretend that that would not happen in our profession. I am a second-generation chiropractor, okay? We already have third-generation chiropractors. We fully assume that we're going to have fourth-generation chiropractors. I do not want my grandchildren, my nieces, my nephews, to have to go to chiropractic college, spend half their time taking medicine, pharmacology, toxicology, what have you, to be able to get their chiropractic license, to be able to practice traditional chiropractic. And I think that's where this would go, and that's why you find those of us fighting you on this so strongly. It's a fundamental change in our profession, and I don't see that it's necessary. I know I hear all the talk about, well, we need more market share, and we need more prestige, and golly, if we do this, then we'll be better recognized by the insurance companies and that sort of thing. Do you sell your soul for some recognition? Do you sell what your profession really is to get a little bit more market share? And like I say, I understand, Dr. Carlson, what you were saying. There are substances out there that y'all may be injecting that you're seeing really awesome results from. And it's true. Chiropractors had to sit in jail. They had to kind of push the envelope to be able to do what they do today. I understand that. But why go backwards to the medicine? If you want to go forwards to natural things, I could get past that. But I do not think that we're doing our profession a favor by trying to push into the drugs, okay? That's where I'm coming from. Right now, as another justification for why I have a problem with this and why I feel like I need to speak out, just last week, I had a gentleman come to my office, and he had been in an auto accident, hauled off to the ER, no x-rays, given some medication, sent out. Goes to a chiropractor, AP doc, okay? He got peppered with injections the first day he's there. No x-rays, no adjustment. Had him come back the second day. More peppered injections, whatever that means. And no adjustment, no x-rays. 5 days later, another session of injections, no x-rays, no adjustment. And I'm sitting there and I'm saying to this potential patient, do you know what you were injected with? No, I don't. Was it explained to you what side effects perhaps there would be? No. Were you explained, well, this effect or that effect or the other effect may occur, be prepared for this. You may hurt worse before you feel better. No. He had progressively been getting worse, okay? How do I deal with that? As a traditional chiropractor, having someone come in, I don't know what they've been injected with. I don't know if they've been injected with the properly. They haven't been told what to expect, and I have to deal with that. And so what do? go take AP courses so I can kind of figure out what's going on. At least when somebody comes in with prescription drugs, I have a PDR to go to. So those are my concerns. Those are my problems. And like I say, I'm not as eloquent as these other people. I've kind of shoved the elephant in the room up front. But I think that to go forward presently based on what legal opinions have been made, based on that alone, I think would reflect poorly on our profession. And I really think that you all need to give this greater consideration and understand that I don't like arguing with my own colleagues. I don't. I would like to stay in my office, take care of my patients, and never have to come do something like this. But pushing past the vitamins, minerals, and herbals, I had to draw a line in the sand, I'm sorry. And I hope that you guys understand that I'm not meaning to offend anybody. I'm appreciate that you give me this opportunity. I appreciate the hard work that you guys do. It can't be easy to do this type of thing. I know it's time consuming, but I do believe that those of us that have problems with this aren't meaning ever to question the education of any of our colleagues, and we'd like to get along, but there are certain things that we just can't get past. And so I appreciate you giving me this opportunity.
Thank you. Does the board have any questions of this witness? Okay,